Hi everyone, welcome to Biology with Mary Nyosk. Today we are going to discuss about Giardiasis. This one is a disease and it's a gastrointestinal disease that is caused by protozoans. Protozoans that cause Giardiasis disease is the Giardia intestinalis, Giardia lamblia, and the Giardia duodenalis. These types of protozoans have their flagella and they exist in two forms, as a cyst and as a trophozoite. Now, when it exists as a cyst, it exists outside a host or a reservoir host. Begin with, how can a person be infected by this type of infection? The risk of being infected with giardiasis occurs when you ingest food that has been contaminated with feces that contain the protozoans. Also, you can ingest water that is not treated or water that is not boiled, and earlier on the water had been contaminated with the feces that had the protozoans. Also, you can be infected by getting into contact with feces, maybe from a kid, when you are changing a kid. So it's normally advised that after you change a baby, the diapers and whatever, make sure you clean your hands thoroughly so that you can get rid of the infectious protozoans. Also, before you drink water, make sure you treat it. And if you are doubting that probably the water is not treated, you can always boil the water. Last but not least is, before you eat a fruit or before you eat any kind of vegetable, make sure you wash it thoroughly, and if you need to cook it well. When it infects a person, a human being, that's when the cyst develops into a trophozoite, and the trophozoite occurs as the small intestine, where it has got the suckers, which helps the trophozoite to attach itself to the small intestine. When this happens, the trophozoites tend to trigger signs and symptoms. That's when a person develops signs and symptoms that can help you to tell that you are infected and there is a disease that is in your body. These flagellated protozoans normally have reservoir hosts where they can be able to survive in. Especially this reservoir host includes the cats, the cows, and the dogs. So when you get into contact with these kind of organisms, of animals, make sure you clean your hands very well, and also have a place where the dogs and the cats can be able to use as their latrines. So when you are already infected with the protozoans that causes giardiasis, there are symptoms that comes about, and before you experience the symptoms, that may take a period of 1 week or 2 to 3 weeks and above, so that the symptoms can be manifested. That period of time, it's enough for the cyst to develop into trophozoites. The signs and the symptoms of giardiasis is as follows. You will have a person experiencing diarrhea. Also, the person may be in a position of vomiting, feeling nausea, sometimes nausea without vomit or with vomit, removing of gases, and also they may be in a position of losing their weight, simply because at such a time someone is diarrheaing a lot, and most of the time they normally lack that appetite for food. Also, this person may experience abdominal pain, severe cramps. If you see someone or if you're experiencing such symptoms, it's advisable for you to go to the hospital so that they can test you and they can perform some diagnosis so that they can be able to tell whether you are suffering from Giardiasis or something else for the sake of being treated properly. So when this happens and you are experiencing the symptoms, you can always go to the hospital. They perform some diagnosis, and the diagnosis includes they can use microscope, that is collecting sample from you. Then they can be able to make a specimen so that they can observe the protozoans and see whether it's Giardia species or something else. The microscopy observation is done thrice because the stool can also be having other microorganisms that may cause diseases. Secondly, they might try to use the antigen test, that is testing the stool to see whether they can see the Giardial proteins. Also, they can obtain the fluid of duodenum so that they can be able to test and see whether it contains the Giardial protozoans. And when the results comes, that's when the doctor or the lab technician can be able to prescribe the kind of drugs that you need. When it comes to treatment, I'm going to tell you the type of drugs that you need for the treatment of giardiasis. You can use metronidazole or tinidazole or any other medicine that you've been prescribed by either a chemist or a doctor. Thank you guys for watching this episode of Giardiasis. Hope you've been able to understand what Giardiasis is, the conservative agents, and also their reservoir hosts. Give this video a thumbs up, like the channel, subscribe if you've not subscribed. Make sure you turn on the notification bell so that you can be notified whenever I upload a video. Bye bye, see you in my next video. Peace.